And the topic for discussion now is thyroid and various thyroid disorders. Thyroid is one of the important endocrine gland of the human body, where the hormones released by it actually maintain the homeostasis of the body. Very much important for the basal metabolic rate and other things. So let us discuss about various thyroid disorders, both hyperthyroidism and hypothyroidism, their clinical manifestations and their oral manifestations, and how they actually been treated. Coming to thyroid, is the gland which is again present just below the thyroid cartilage, and as we know, it has two lobes which is connected by the isthmus. So this is about a picture of thyroid, and I'll not go much into detail of the anatomy there. Now coming to the thyroid system. Thyroid gland is actually been stimulated by the hormones that are released by the hypothalamus, especially the anterior pituitary gland. The hormones that have been released are TSH, that is thyroid stimulating hormone, and thyrotropin releasing hormone. These hormones, the thyrotropin releasing hormone from the hypothalamus will go and stimulate the anterior pituitary gland. The TRH will stimulate anterior pituitary gland, where it releases this TSH, that is nothing but thyroid stimulating hormone. This thyroid stimulating hormone will have its effect on the stimulating effect on the thyroid gland, which will result in releasing two hormones, that is nothing but T3 and T4. T4 is nothing but tetraiodothyronine or thyroxine, and T3 is nothing but triiodothyronine. Here what happens, the important action of these thyroid hormones is nothing but it will lead to increased metabolism, growth and development, and increased catecholamine effect. Coming to various functions of thyroid, thyroid hormones are actually having multitude of functions, and some of them include maintaining the basal metabolic rate, their effect on the plasma and liver fat, vitamin metabolism, in protein, carbohydrate and fat metabolism, and also on the body temperature. Coming to disorders of thyroid gland, we have this thyroid hormone, either T3 or T4, they are being elevated in the plasma. Then it leads to hyperthyroidism. In hyperthyroidism, it can be because of Graves' disease or toxic nodular goiter, thyroiditis, or pituitary or ectopic TSH, or thyroid carcinoma. The most common clinical features is patient usually exhibit irritability. They have proptosis of the eye or exophthalmos. Conjunctival edema can be seen here. Tremors and tachycardia. Patients usually have psychosis, warm extremities, and palmar erythema. Patients usually in hyperthyroidism, they actually have hyperthyroidism. They lose weight and they are intolerant to heat, and in this case they have weight loss also. They lose the weight, but they have excessive hunger. Okay, and goiter can also be seen in these cases. Increased appetite, behavioral change or restlessness, muscle weakness, gynecomastia, breathlessness, palpitations, heat intolerance, tall stature in children, hyperactive children, atrial fibrillation or tachycardia can be seen. Coming to oral manifestations, they have wide-eyed staring and alveolar bone atrophy, premature shedding of deciduous teeth can be seen, accelerated eruption of permanent teeth, and increased susceptibility oral infections. Coming to the radiographic features, normally they have generalized loss of alveolar bone density here. Thyroid storm. Thyroid storm is nothing but there is uncontrolled hyperthyroidism. Patients usually have delirium, elevated temperature, and tachycardia. Coming to Graves' disease. Graves' disease is again a form of hyperthyroidism. In this, what happens is it is actually an autoimmune in nature. These autoantibodies are directed against the receptors for TSH. So what happens? TSH is not being, the thyroid stimulating hormone is not happening there. Are directed against those receptors. So their thyroid stimulating hormone receptors are not working there on the surface of the thyroid cells. There will be diffuse thyroid enlargement leading to clinical signs such as nervousness. Patients will have heart palpitations, heat intolerance, emotional lability, and muscle weakness. They will also have weight loss despite of increased appetite, excessive perspiration, tachycardia, warm and smooth skin, tremors, and exophthalmos can be seen. So what are the various investigations for hyperthyroidism? T3 and T4 are elevated, TSH is low, iodine 131 uptake is increased, ECG shows tachycardia and arrhythmias, and ultrasound will show diffuse goiter. How do we actually manage? It is with drug therapy, where carbimazole 10 to 20 mg per daily, potassium iodide, beta blockers, propyl thiouracil for 100 to 200 mg 8 hourly will be helpful in controlling this hyperthyroidism. Regard to radiation and surgery in case of extreme hyperthyroidism, And